Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, for every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, it's a Friday version of the show, a little different in one way. We're going to bring a guest to you that I was hoping to get to you earlier in the week. However, her schedule was so busy, she couldn't pull it off. Now she tells me she's driving from Jacksonville to Miami, and I guess she's a captured audience. Anyway, I'm talking about Shannon Goosen, who's going to be coming aboard today to talk more about the up-and-coming Microcurrent Therapy Conference, the training conference that you really need to be a part of. And I'll be giving you more details about that in just a moment. But our guest today is Shannon, who's really been our guiding light when it comes to the use of microcurrent in medical practice, as well as in your own home, and how you can take care of medical issues, in a completely safe way, in a way that really medical science has never seen before. How fantastic it can be to make it part of what your family does. The Microcurrent Conference coming to town. I'll give you the particulars on that in just a moment. And Shannon will be right with us right after our first break to describe to you, whether you're a layperson or practitioner, how you'll want to be a part of it. So, now in the course of our discussion with Shannon this morning, and then when we finally sort of break off, you can come on in at any time and ask a question or make a comment. The number to do that, as you should know by now, is to dial us up at 412-825-6262. That's 412-825-6262. And I will give that number additionally throughout the hour. So let's look at up-and-coming guest. Shannon's going to be with us today on Monday. Sort of the other half of that microcurrent combination. He's still Western Pennsylvania half, because he's been working with microcurrent for 6 years now, as well as a clinician in the use of trigger point myotherapy for many, many years beyond that. Of course, he's in the office seeing patients along with me, helping them to find those frequencies to get their issues turned around. His name is Richard Finn. He's been on our show once before. He's been in my office since just a little over a month ago, and he's a big hit here, folks. And he'll be a part of the Microcurrent Conference on the 10, 11, and 12. As I say, in a moment, I'll get to more of that. Richard Finn will be our guest on Monday. Then, I don't know whether you know this or not, and after listening to Bill tell you about the weather report for this weekend, somebody's in a time warp. We going to have a cool one. We turn the page next week on the month of March, and we're actually moving in the month of April. We kick it off on April 1st with Dr. Boom herself, the second one, that is Susan Smith-Jones. Dr. Susan Smith-Jones will be with us, and you always know she takes over and runs the place. She'll run it on April 1. I know you enjoy having her on board. I certainly do, too. Last night I wasn't able to make it out there to the Freedom of Choice in Cancer Therapy group, and I always do. Now, I had a good excuse because I was lecturing to a class of bioengineers at the University of Pittsburgh, and I would literally look forward to that opportunity to talk to them about microcurrent, because they will be the investigators and the developers of new devices in the future. This is just such a new science. There aren't many out there doing it, and I thought it was really great to have that opportunity extended to me. And I was really enjoying myself at the engineering building, the Benedict building out there in Oakland. And for that reason, I couldn't make it to CAST last night. If somebody can report to us how that all went. I know he lights up a room. I'm sure everybody that was out there really enjoyed themselves. Love to hear how it went. So as we open this up this morning, maybe somebody will come back and report to me how things did go out there at the Freedom of Choice in Cancer Therapy group. Sylvie had her spring kickoff with Cass Ingram coming to town. We had him on the show on Wednesday, and he was going to be talking about Lyme's disease and, of course, much more. And I'm anxious to find out what the much more was all about. So my apologies for not making it out there last night. I really would have loved to, but I had some extra duty to be involved with at the University of Pittsburgh. And it was an enjoyable opportunity to meet those young students. Had a chance to meet some of the administrative higher-ups too, and I think there's more to be done here at the University of Pittsburgh in the bioengineering department. Okay, let's talk about TLS program. Look, there's just a couple of days left. If you think you'd like to be a part, what has become a pretty popular, well, two ways to look at it. Either a weight loss program, a sensible one over a 10-week period of time, and there have been plenty of my patients, as well as just people off the street who felt they wanted that kind of help with this TLS program. That's a transition and lifestyle systems that we first introduced here in Western Pennsylvania back in was September. Was our first group. Went through 10 weeks. They hit their goals. Usually they were in two categories. One, folks that just wanted to lose weight and seemingly had trouble doing so. And number two, a group of patients who were either already established diabetics or were moving down a path of becoming one very soon. This is all determined by the use of a lab that I'd recommend that every one of you out there get to put yourself in a category of safety or of concern, depending on how elevated the hemoglobin A1C level can get. And when I've seen these things go awry, it's been very rare to find a patient that on their own has been able to get this thing under control. What I found out was these TLS programs, the one we had in September, went for 10 weeks, finished right about the beginning of December. And now this newer group, the one that began in January, just finishing up now, these hemoglobin A1C levels are now manageable. They're in a safe range, and I think it's really to the benefit of those who weren't doing too well prior to their opportunity to join TLS. Now, we're starting a brand new one, the third one, coming up here on April 1. If you think you'd like to be a part of the TLS program, give us a call here at the office at 724-942-3002. That's 724-942-3002. And talk to Sister Sarah, and she'll get you enrolled in this group. They're going to begin, I guess, Wednesday evenings. It's a new one. We had these things on Saturday, and certainly it was a day that most people were free. Maybe they decided, they didn't ask me about it they decided maybe they needed a midweek one, and so these will be held on Wednesday evening, 7 o'clock at Dr. Tyson Swigert's office. It's known as South Point Chiropractic, and it's right at the I-79 exit at South Point. So more specific directions, you can't miss it, but easily a landmark, easily found. And Wednesday evenings looks like that's where people are going to be inbound to go. Okay, eye program. I was a little mistaken. I had Sarah set me straight. The eye program for the month of April will be the 27th, the 28th, and 29th. I know I had that backwards the other day when I told you it was going to be 20, 21, and 22. Looking at the board, there's so much going on in the midweeks of April that we're just going to push this to April 27, 8, and 9. If you have eye afflictions, if you have especially retinal issues like MACD, that's a simple way of saying macular degeneration. It doesn't matter whether it's wet or dry. Glaucoma, diabetic retinopathy, retinitis pigmentosa, macular pucker, macular hole, and the list keeps going on. These are all disorders of the retina, and consequently, there is no place to go to get any improvement in the conventional medical world. Dr. Ed Condrat, 14 years ago, put himself out there as a person that could put a program together, and boy, did he ever. That consists of 3 days of aggressive treatment and an improvement in every single one of those serious cases in that 3 days. And many times, it's substantial. So if you'd like to learn more about the eye program, or if you already know you're interested, it's going to be all the dates in April will be 27, 8, and 9, 27th, 28th, 29th. Also call here, talk to Sister Sarah. Sister Sarah is doing so much for me, actually. We love her here, 724-942-3002, so that she can start to collect your information. You know, it all gets sent. Dr. Condrat, he is involved with every single patient that comes through our 3-day program here. He gets their records. He makes certain of the diagnosis. He then is the only one that programs the microcurrent device, this unique thing that gives us so many advantages. But he programs it specific to the patient's needs who is coming here. And each and every program are different, every single one of them. So more on that subject, just give us a call here, 724-942-3002. Now, a little bit about this conference coming up in anticipation of Shannon phoning up here in the next few minutes as she drives down to Miami from Jacksonville. And I'm going to ask her today, if you're a lay person, what does she intend to do to help you get a better handle on how to use microcurrent in your own family? And then if you're a practitioner, what it would be that you can expect to learn on an ongoing basis. You need some direction and help. These devices are simple in a way, complicated in another, and they're going to need programmed by you. And you're going to have to be brought along in order to learn how to do those programmings. That's the unique thing about FSM. It's frequency specific, it's patient specific, it's disorder specific, and the more specificity it can go in with developing those frequencies, the better chance there'll be in getting these issues turned around. Anyway, conference coming up April 10, 11, and 12. Going to be held at the Crown Plaza Hotel in the South Hills, directly across the street from South Hills Village on Fort Catch Road. It is a full amenity hotel, and we have a corporate account there, and there is a discount for those who feel they want to stay there rather than traveling home on Saturday night to come back on Sunday. Now, why would you do that? Well, here's why. Our layperson day, the non-practitioner day, will be all day on Friday, April 10th. If you are involved with microcurrent in any way, if you are a patient who is using microcurrent devices, and now many of you out here in Western Pennsylvania, I suggest that you become a part of that layperson day to learn more and more about those devices to help you and members of your family. Then on Saturday and Sunday, half day, if you're a practitioner like a medical doctor, an osteopathic doctor, a DO, there's MDs, DOs, there are DCs, that chiropractors. Hey, what if you're an optometrist? What if you are a massage therapist? What if you are a naturopath? The list of practitioners goes on and on and on, and you end up dealing with, sometimes you call them clients, sometimes you call them patients, but you're actually treating them for their issues, many of which times are pain issues, and that you need an edge, and microcurrent is that edge. So you'll want to be a part of this initial first time, I think, to be taught in Western Pennsylvania coursework for practitioners, and that'll be on Saturday, April 11th, and half day on Sunday. That's why I mentioned if you're traveling any distance to be part of it, you might very well like to stay at the Crown Plaza. We have a $99 rate. That, I believe, is a substantial discount compared to what the regular room rates are there. And all you have to do is dial up the hotel number, all found, by the way, on the website. Please go to it. The website address is Microcurrent Conference. That's microcurrentconference.com. And you can check on the speakers, the agenda, the dates, the times, the place. The hotel is featured there, and the phone number to call to be able to stay there if you choose to. And the code you'll be asked for to get that rate is Courtney Medical Group. Once you produce that code, you'll get the $99 rate and be set to be a part of it. So we intend today to talk to Shannon Goosen, who is really organizing this. She is a teacher extraordinaire. She's been doing this for a long time. She's recognized as the go-to person by those in the know with teaching these devices and how to use them. We're so happy to have her as part of this Pittsburgh presentation. And we're going to do this. We're going to take a short break. Shannon should have maybe checked in by now. And hopefully we'll be able to have a discussion and hear from her how she has this thing planned, what she intends to do. So if you're a layperson sitting on the fence wondering, geez, I wonder if I should do that, stay tuned. Keep listening. If you're a practitioner, do the same. We'll take a short break and be back in a moment with Shannon Goosen. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHP 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday morning version of the show, slightly different. It's not our traditional get 'em up out of town version. We got some objectives to obtain, and we need to get across to you out there, maybe titillate you enough to become a part of something very special here for Western Pennsylvania. We really introduced microcurrent as a treatment modality for a number of months now through the eyes and the voice of someone you've come to really respect in this area. Her name is Shannon Goosen. She is our go-to person when it comes to all things microcurrent, and we've been having her on our show each and every month on what we called Microcurrent Mondays. Well, I know this is not a Monday, but this is a special event because up and coming in the month of April, just around the corner, is a conference that Shannon just said she had to have, that Western Pennsylvania needed, and they needed it local, and she consented to be able to put one on for us here. That Microcurrent conference is going to be held on April 10, 11, and 12, and it really appeals and should appeal to two types of individuals. One who don't treat anybody other than themselves or may be involved in family members who have afflictions, and then have the microcurrent programs developed for them. Or two, what if you're a practitioner and you actually treat individuals that come to you for various reasons? You're going to have a need to be able to program these devices and to learn what frequencies may work best for whatever problems you're treating them for. That being said, Shannon is with us now. We're going to go to her and talk about the conference and maybe ask some questions that for you fence sitters out there may be able to get you to the point where you'll give us a call and enroll. Enough said. We've got her with us. She's driving folks to Miami. I don't know why, but she's our captive audience right now. Good morning, Shannon. Thanks for coming aboard.
Dennis.
Hey, I want you to drive safely while you're talking to us today, but so happy. You know, you're a tough one to corral. You've been all over the United States in the last week, out of town, in town, now out of town again. So you never let the grass grow under your feet. That's one thing I've learned about Shannon Goosen. But Shannon, because you thought it should happen, it's going to happen, and you put together an interesting conference up and coming for the month of April, 10, 11, and 12. We've set aside two different types of student. One we'll call layperson, the other we'll call practitioner. So could you take a moment, talk to us about why it was so important for Western Pennsylvania to have their own conference, and try to make a pitch to the folks that are out there, maybe sitting on the fence in the layperson column and the practitioner column. What is this conference supposed to do for them? Let's talk about the conference in general. You wanted it to happen. We made it happen, and it's going to be right around the corner. Take it away.
Yeah. Thanks, Dennis. And the first thing I'd like to let your listeners know is that I am actually a passenger in a car now. So I have someone very safely driving me south.
Oh, good.
Miami. So no one needs to be concerned that I'm behind the wheel and on the radio at the same time. So my full attention is on you and your listeners. And secondly, Dennis, I'd say that since it's not a Microcurrent Monday, today we're having a Frequency Friday.
A Frequency Friday. I like the combination.
Let's talk about frequencies on Friday.
Like,
so, go ahead.
No, I just said because when we first started this conversation, way back, when we met in October, reunited, and then every month since then, you've come to the radio show with a great message of how microcurrent can be helpful, but always in the back of your mind, you felt there needed to be training for those people out here in Western Pennsylvania. So how important is this training? And tell us about the conference that you put together and what it's going to consist of, and try to address those two individuals that we're trying to encourage to come, the layperson and the practitioner. Take it away.
The first point, Dennis, that we've talked about since October is that in order for us to actually have an impact on what is happening with medicine right now, the patient and the practitioners have to demand some changes. And there is this technology of electrical medicine that is now becoming even popular, such that it made Scientific American. There is a neurosurgeon that is now looking at doing implantable microcurrent devices. The military is looking at it as one of the top 7 great advances that they are investigating and using it to treat their veterans and treat the military troops if there's been any kind of injuries. And so we really are moving into 21st century medicine. And what I feel is so important is that patients and practitioners alike have access to these tools that have been around for well over 100 years and have had life-changing effects on patient after patient after patient and practitioner, because of what happens when they see how profoundly they can make a change in someone's life. So we need to have the ability to get this information into the hands of the patient, Dennis, so they can go in and say, I know that these frequencies and electrical medicine heals, and I want access to it. And I know that if something happens to me, I can get a better outcome if I have access to this type of medical modality. And I know that if I have any kind of chronic problem or chronic pain problem, that this actually works better than anything else we have available right now. So once again, it is going to be the consumer that pushes medicine to change. And we see this happen all the time. When the consumer demands it, medicine has to change with the consumer. And practitioners need to have access to quality training so that they can be very savvy in what patients need and how to treat them using these different electrical modalities. So, Dr. Courtney, you have been using microcurrent for your eye protocol. You're doing something very, very specialized, and then you found out that we have people that can specialize in every other area of physical medicine and actually help these folks. So it's time for us to get started in Western Pennsylvania. There is a group of practitioners that are uniquely trained in treating myofascial pain and other chronic pain conditions. And so this is the perfect region with you at the helm for us to start delivering the information on how people can effectively take back their health care and take command over their wellness and be able to treat themselves, and practitioners to finally be given the information that has been around for 100 years on what we can actually do using electrical medicine and microcurrent. And Dennis, I'm curious because I know that you were invited to teach, I believe it was the University of Pittsburgh, and you were there last night. And the other part of this equation, if we look at it like a three-pronged stool, is that we need to have equipment that people have access to and a variety of it. And I understand that you actually got to give a lecture last night to the bioengineering department, and these are our young, bright minds of the future that are actually going to be the ones to develop really, really more advanced microcurrent equipment than we've probably ever seen. And I think this is where things are headed. So why don't you just tell me a little bit about what happened for you last night?
Well, truth be told, the reason I was able to address that group is that somebody I know really took the time to put the slides together for me so well that I could tell the story, and the story had a logical progression to it. And of course, that someone was you. So first of all, I want to thank you for prepping me in a way that I could do a professional presentation, and it was certainly professionally done. Of course, you and I both know the reason that I went to meet these folks is that the devices that we have, they're pretty good, but they're still so in the elementary stages of their development that it's going to require some very energetic and enthusiastic and passionate, sophisticated scientific minds to move into the arena that the medical doctor has no place in. I have no idea about circuitry and electronics and electricity, but these folks do. And we know that when Dr. Condrat, who really has and should be commended for his role he's played with eye diseases, teamed up with a similar individual with that background. Now his name is Ning Wu, and I know you know him. The two of them together came out with a device you and I both use today, and we're hoping that by exposing the young minds sitting in that class last night, there'll be another Ning Wu or someone like Ning Wu who'll be able to develop the next device and the device after that. So it was my first opportunity. I can tell you that I had a lot of interest of those who were sitting in the class. I can also tell you that Chris Ubinger, who is the teacher of the class and invited me to come give that address, has made a pledge to me that this is going to be every semester I'm going to be invited to meet the next group and the next group and the next group, and we hope that something comes from it because of the close proximity to that engineering building and the large medical complex in Pittsburgh at UPMC and the University of Pittsburgh Medical School. I think there's a great opportunity for this to catch fire, so to speak, and maybe, just maybe, in a short period of time, we'll have our next device hit the drawing board. Thanks for allowing me to make that presentation, Shannon, for all the help you gave me, and I think it was the message came across loud and clear. I'm looking forward for my next opportunity to address the next group next semester.
That's fabulous, Dennis. And this really brings forth the concept that this is where we need to have collaboration. We have different investigators and researchers that are inside research facilities, and they are investigating all types of things that have to do with health, illness, any kind of advances that we need for medicine and biochemistry and what's happening to people in their lives and the problems that we have. And then there's this disconnect with researchers sometimes being able to connect with the foot soldiers, which are the practitioners with their feet on the ground. When we are day in, day out with our patients, and we understand our needs and then their needs, and then sometimes our hands are just tied. And so you bring up Ning Wu, who is just the most lovely, delightful engineer I've ever met. And he is so passionate about trying to develop equipment. He's one person. He's got a small team around him, but he is doing all of this himself. I would love it if he had bioengineers that wanted to come intern with him to learn what he's done and then to help. Because every time we do equipment, and we've got new equipment that's coming out soon from Ning Wu. I was able to collaborate with him, and we're going to have the next generation of device that is going to be fantastic for your patients, for my patients, for all the practitioners around the United States. There's other things that are going on, and we just need to keep moving forward with what we need in this equipment. And as you know, I talk about different types of frequencies that heal, and there's different types of waveforms that heal and do different things, and we need to look forward to one day in the future where we can combine all of this. And I look forward at the conference not only explain to all of the lay people and anyone that considers themselves a pain patient right now or suffering with some kind of chronic problem, to come out and find out where we are with research and what we can look forward to and what is available right now. And Dennis, from my practice and what I've done, that we have equipment right now that is incredibly effective. It's available for patients to use at home. They can get it with a physician prescription, which you're able to do, and patients are able to have access to this kind of treatment in the privacy of their own home and use it for a variety of conditions, and then also have frequencies in case there's any kind of medical injury that happens to them, or they have some kind of acute injury. We're able to very, very effectively treat those types of problems. So your patients and any layperson out there that's listening, this is a fantastic opportunity for you to get educated on what's actually available that you may not know about, and then get detailed, systematic explanation of the theory behind why this works, how you use it, and how you figure out what's going on so you know what to use, and be able to manage your issues at home, and in many cases completely ameliorate or resolve what is ever happening. And certainly last night, Dennis, you got to tell the story about how effectively we treat fibromyalgia when patients unknowingly have had neck injuries that are actually causing it, which is well over 2 million people in the United States. So often people are suffering from pain problems. They're on narcotics. They've had a bunch of injections. No one really knows what's wrong with them. And they keep on just having drugs and procedures thrown at them that aren't working. Well, we've got something that resolves that in most every case. And so there is an easy, painless way to start getting those pain problems resolved quickly. And you got to talk about that last night. Practitioners that are out there, whether you realize it or not, there are large companies that are doing biomedical devices, and the the government and the military, they are on to us. They know what we have effectively been doing with energy medicine and using microcurrent to treat patients. They know that it works. They are adopting it into their arsenal of care, and they realize that our current method treating chronic conditions in the United States has failed. It's costing us billions and billions of dollars with no results. And everybody realizes that we are about to move into this new paradigm that Dr. Courtney is introducing at the Microcurrent Conference. And if you want to be ahead of the curve and what's about to happen with medicine, you need to come to the meeting, you need to come to the conference, and you need to find out what is happening with energy medicine and using microcurrent therapies effectively and efficiently in your practice. So Dennis, take it away from there.
Well, you know, one time on our show, and I thought this was a lesson I learned well, and I think it's a very appropriate time to reintroduce that. I remember asking you about that because the public doesn't understand the layers of complexity here. I remember you saying microcurrent, all microcurrent is good, but it's this frequency-specific form of device that is the optimal way to use microcurrent. And we are now having, and that we have arrived to that level of sophistication. So there are plenty of folks that have electrical devices that they may very well think are administering microcurrent to them, and more than likely are, and they're more likely getting benefit from it. But could you just take a moment to talk about the device that really got to be the selected one, which is the frequency-specific kind, because that is where practitioners can write programs specifically with a patient in mind and their entire pedigree and background, and that just can't happen with a switch-on, one-size-fits-all device. Could you go over that again? I thought it was a great point that you made, talking about the kinds of microcurrent that are available out there.
Absolutely, Dennis. And first, remember we talked about pens and microcurrent. And so when we talk about pens, when we're doing milliamperage, that it's amperage that you can actually feel. It stimulates the muscles, it stimulates the nerves, you can feel it. And when you are putting those pen-type devices onto the body, they're actually used to block pain signals going into the spinal cord and finally into the brain so that you don't feel the pain. You've got mechanical information coming into the body that blocks it. So we had talked about before, the challenge with pens is the research that was done on that as far as what happens to us from an energy standpoint is that it actually depletes energy from the body, which is what you need while you're trying to heal. Microcurrent comes into the body in millionths of an ampere, and that current is physiologic, meaning that is already the type of current that is in your body that is being used for your nerves to communicate with your muscles, with your cells, in your brain. It's physiologic. We are already running on microcurrent, and movement in our battery, in our muscles actually creates like a battery activity. So we're generating this microcurrent with movement. So side note, this is why to keep moving is very important. And anything we can do to get our patients out of pain to keep them moving is going to make a difference in and of itself in their health. So now we know the difference between the traditional pens, which you can feel, as opposed to just regular microcurrent. Now when we're talking about microcurrent, which comes through in millionths of an ampere, the research has been very, very positive on microcurrent in general, that it increases ATP, adenosine triphosphate, which is what your little power plant mitochondria produce in order to power absolutely everything in our bodies. That is where our energy comes from, that keeps us moving and alive and functioning and our brains working. And so we know that microcurrent actually increases ATP, or energy in the body, up to 500% when they have done laboratory studies. We know that it increases protein synthesis. We know that it increases collagen. And once again, this is coming from researchers. that are in a research lab that are looking at this, not fully understanding how incredibly important this is for practitioners because it can totally change the lives of their patients. So now that we know this piece of information, we know that all microcurrent in and of itself is good for us. Then enter specific frequencies. There are frequencies that showed up from the late 1800s, early 1900s. Don't know exactly where they came from, but once they were studied in different types of research settings, we found out that specific frequencies do specific things in the body. And when we use dual channel, which means we have a channel A and a channel B delivering the current, we can actually run a specific frequency for a condition and a specific frequency for a target tissue. And the most important research to date that has been done from my perspective to actually demonstrate the truth in that was that the specific frequency combination for people that have cervical trauma fibromyalgia, which means you have a neck injury or you have something going on in your spine and you have inflammation in your spinal cord causing full body pain. Well, if you run two specific frequencies for inflammation in spinal cord, it drastically reduces your pain. More importantly, there is a researcher that was at NIH that agreed to evaluate the blood samples of patients being treated. Those blood samples were taken at the beginning of treatment, 30, 60, and 90 minutes, and he evaluated for inflammatory cytokines and molecules that are actually markers for inflammation and pain, and also markers that are indicative of people feeling good and having serotonin levels go up and having a sense of well-being. Well, in that study, all patients that were evaluated, the bad stuff went down and the good stuff went up. But what happened, Dennis, as you know, is that it happened in 90 minutes. It happened at a logarithmic rate by a factor of 10. And those markers for pain and inflammation changed in a way that is understood to be medically impossible. So we know when we put these specific frequencies on, it changes. There was a control patient that didn't have this issue, and absolutely nothing changed in that patient. And so we have other studies that have been done in laboratory animals that show the frequencies specific to inflammation reduce the type of inflammation that we treat with non-steroidal anti-inflammatory drugs. It reduces it by 60% in less than 4 minutes. And no other frequency combination does that. So I bring that up. We know that there is something very, very special about using these specific frequencies. And the whole point of this training is for us to demonstrate and show people what the different types of things that happen in the body and the spinal cord and with joints and nerves and things that actually cause this pain and inflammation, that we actually have specific frequencies for those conditions. And the whole point of this conference is to share that with the lay people and patients so that they understand what frequencies they need. And then for practitioners to finally learn how to figure out what these physical medicine conditions are that have to do with the spine and the joints and the nervous system so they can quickly and efficiently evaluate to know the source of pain. And then they'll learn the frequencies and they'll know exactly how to treat it and change it.
Wonderful.
Take it away, Dennis.
Well, by the way, that little thing that you just mentioned about the cytokines and all those factors that changed, I want to emphasize that those were all changes that occurred on one treatment alone of 90 minutes.
Correct.
And these were numbers heretofore never seen in any arena of medicine whatsoever. They were so astounding that the medical doctors who looked at them looked at with an astonished look on their face and had to reconfirm, is this actually true? No other medical approach has been able to do what one microcurrent treatment has already demonstrated that it can do. To me, that is a thing that I'd like to convey, and I do convey to my patients on how astounding microcurrent can be. If we just find the right frequencies, we can change a whole bunch of stuff. You keep talking about pain problems, and that's your basis for coming into the realm of microcurrent. There I was out there treating eye disorders, organic issues, really for the most part, no pain involved with them at all. It doesn't matter whether it's organic disease or chronic pain of any type. Microcurrent can be used to win the day and turn things around when nothing else can. And I think it's now time for Western Pennsylvania to get that exposure. That's how the conference came about. You put it together. April 10, 11, and 12. On April 10, for the lay persons, what's going to happen to them during the day? What are you going to teach them?
What we're going to be talking about is they will just get background on what we know about where these microcurrent treatments came from, and then going right into the research that's been done. Because so often someone will go in and say, I'm getting microcurrent treatment, and maybe their general practitioner or one of their doctors or their orthopod or their pain practitioner, they might just look at them and roll their eyes or saying, oh, you're using TENS, and it's like, no, it's microcurrent, and they'll just look at them and say, whatever, because they don't know anything about it, and they won't question it. So the patients and the lay people will now have an opportunity to have access to the research that they'll be able to take to their other practitioners and say, you know what, this research is out here. You need to read this and know about this, because this is where medicine is going. And this is what is working for me, and it can be working for your other patients as well. And they don't need to be on all these narcotics, serious
drugs, sure,
medications that are causing so many complications. There's a lot of people that just don't need to be on them. And then they're going to understand the application of using microcurrent and how it can help them in their daily life, and how they are going to be able to apply it at home, and what different issues they are going to be able to effectively treat in their daily lives that have to do with improving health. We've got frequencies for inflammation. And finally, of course, medicine is over a decade late on this once again, but they finally came out and said, oh, by the way, we now realize that inflammation is the root cause of almost all disease. And we have not been treating upstream enough from where this is coming from. Well, we've got frequencies that are very effective in treating inflammation when applied correctly. So your patients and the lay people will learn and understand how to use these frequencies to keep the inflammation down in their body. The whole point of the neurosurgeon that is doing this implantable microcurrent device stimulate the vagus nerve, and we've already got equipment and we've been doing that for years and seeing these results. It is a neurosurgeon that was able to prove to his colleagues who laughed at him that if you stimulate the vagus nerve and you stimulate the brain, there is something that happens fundamentally at the immune system that changes it. And what he found is he completely had a positive effect on the immune system, and he could immediately see that these chronic diseases of arthritis, autoimmune disorders, rheumatoid arthritis, all of these really serious autoimmune diseases and inflammatory diseases, he sees that he's got a non-pharmacological way to actually treat these problems effectively. And so the people that come to that layperson and patient lecture on Friday are going to learn about this, and they're going to learn how they don't have to wait 3 years for a device to come out and have something implanted because they have to be have something surgically implanted. We've got stuff right now. We've got medical equipment that is FDA approved, 510K, that is actually already doing this. The far-reaching effect of microcurrent is we reduce inflammation in the body, and when you reduce inflammation in the body, you improve health, people don't get sick, and they do not go into these chronic, debilitating disorders.
Perfect. Now, what about the practitioners? So many people out there are treating individuals right now. Sometimes they refer to them as clients. Other people refer to them as patients. But be that as it may, people are getting treated by them already. there's a layer of sophistication that could be brought into that treatment process. Describe how the practitioner can benefit from their exposure in this conference.
They will get the information that the patients and lay people will be getting and clients will be getting, which is important because now these people will have the same basis of understanding for why they're using microcurrent therapy. And what happens next for the professional practitioners is I will tell you what the practitioners have always told me when they come to these trainings, and I've been teaching for a very long time, is that when they went to medical school, when they went to chiropractic school, when they went to massage school, when they did postgraduate training, PT school, whatever, it doesn't matter. There are certain issues that patients have, Dr. Courtney, and basically that information fell out of their brain because it was delivered and then they were told, and there's nothing we can do about it, or you can't effectively treat this, or, we don't know if you're going to get benefit. You can try this. We don't know if it's going to work. So what I learned from all of my students was that they remember hearing a lot of this information about what you do with the spine, what you do with nerves, what you do with the spinal cord, what you need to think about with the brain, what you need to think about with joints. But then there was a piece of it that was, well, there's no point in remembering this because I have no way to treat it. What they're going to find out on Saturday and Sunday is I can revisit all of those conditions that they may have forgotten how to effectively evaluate and show them that they can quickly discern where problems are coming from in the patient, and I'm going to give them the frequencies to treat it. So you've got someone with a bone bruise and you have to tell them it's going to take 6 weeks for it to go away. I'm going to show you how to get rid of it in 6 minutes. Sounds fantastic, sounds impossible. It's not. We do it every day. You've got someone that's full body pain, fibromyalgia, they're on medication, they're on this, they're on that, they're doing the exercise program. You're medicating them, you're adjusting them, you're doing physical therapy, you're doing massage, and you're not getting carryover. I'm going to show you how to take their pain from a 9 out of 10 to a 2 or a 0 out of 10 in 90 minutes, predictably and reliably every time. And it's because we have the frequencies that do this, and not only do we have those frequencies, we have the science with the data that shows us why it works. So you're going to learn all of those frequencies that have to do with the physical medicine, and then you add on the brilliant skill set that you're already using for the physical medicine, and you are going to see drastic changes in your patients very, very quickly like you've never seen before. And now, more importantly, you have a way to get patients a device that they can use at home and treat themselves, and they don't need to be coming into your clinic 3 times a week. You're not going to get emergency phone calls anymore that they're in crisis because they're going to be able to treat themselves at home. At most, you're just going to let them know what programs they need to be using if they're unsure. So it is a complete game changer for a successful practice. And Dr. Courtney, we've talked about it before. As you know, since I started using microcurrent and frequency-specific microcurrent in my practice, I have been on anywhere from a 2 to a 6-week waiting list, depending on where I am and what's happening in my practice. And I have never, ever advertised. My patients have done all the advertising for me. The physicians that I work with, they absolutely tell the patients, I don't know what's wrong. You need to go see Shannon. She'll be able to figure it out. And when something is not getting resolved or there's a crisis, it's just go see Shannon. Well, you know what? We need to have that everywhere in the United States. I am one person, and there are other people like me that are doing this, and all of us have completely full practices. We have millions and millions of patients that need to be reached. We need to get them out of pain, back to life, engaged, back to their families, and they need to be a blessing on the planet and deliver their gift. We have the ability to help them if we learn this information, if we deliver the care, and we empower them to take back their health care. That's my hope and goal.
Well stated. Folks, you don't want to miss this opportunity. It's the first time Western Pennsylvania is going to have the opportunity to be brought into the new age of medicine. Yes, we've been using it in our practice, but there's so many more people that can learn this either from the patient viewpoint or the practitioner viewpoint. Head to your computer now. There's a website, The website is microcurrentconference.com. You'll find all the particulars listed there on this particular conference coming up on April 10, 11, and 12. Keeping in mind, April 10, on Friday, all day is going to be spent with the laypersons group alone. And then on Saturday and Sunday, the practitioners group. It'll be held at the Crown Plaza Hotel here in the South Hills, directly across the street from South Hills Village. Special code will get you a $99 room rate if you feel you want to stay overnight. And then just give us a call here at the office, 724-942-3002 to get yourself registered. You want to talk to Sister Sarah. She is in the office today. Make sure you dial it up. Shannon, thank you so much for spending a little bit of your ride with us today. I don't know what you're going down to Miami for, but I'm sure you'll accomplish your goal and objective, and we'll see you back in the Jacksonville venue very shortly. Thank you.
Thank you very much, Dennis, and a very, very special thank you to Sister Sarah, who was instrumental in getting everything put together and sent out. And she's just a delight to work with. Everybody make that phone call, sign up today. We look forward to seeing you in 2.5 weeks, and it's sure to be a fabulous time.
Okay. Thank you, Shannon. There you have it, folks. Bill's hitting the chopsticks on his keyboard again. That signals our time out of here. Couldn't happen at a better time. The crescendo moment, you know what I mean? Have a great weekend, chilly as it may be. Monday, Richard Finn's going to be on the show and talking about this from his perspective. He's also going to be on the agenda. And then we're moving toward that conference. More about that in the up-and-coming shows. So until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.